Okay, so I hope you got a lot out of that part one of the group process, the group dynamics, how we allow the clients, the patients, it's their group, how we allow them to come up with a group topic. We're going to get more into group topics in another lesson, but right now we're going to move to part two of the group dynamics, which we're going to discuss group goals and how we can achieve the group goals and what the group goals are, and so you can be aware of them when they're happening and how you can use that to help the group move forward and help them achieve their personal treatment plan goals and objectives. Okay, so let's get started with part two. Here's our group. Here's Gary and Sally, John, Billy. It's the one I told you, Billy is a little Jim. So like in my mind, these are actually patients. And when I joke around with Billy, Billy was a little bit, a little bit wild, So, he did very well in group. And so these are like, just put people in there. They're imaginary, but these are our clients. These are our patients. You know what's going on with them. You know what's going on with you. You've done all the information. You have their treatment plan, their psychosocial, their admission assessment. We've done case conference. I know what's going on with everyone in this group. There could be a new person that could come in, but you're gonna help them get through that. Assimilate into the group, because he's going to see other people are talking about their feelings. He's going to look. What's a feelings check? Well, you go number 4, and by the time he gets to 4, you're going to know what a feelings check is. So, and as we're moving along with the group process, they're going to fit in pretty quickly. Especially if you have someone new, they're going to catch up pretty quickly with what the group is about and what they're doing. Okay, so today we're going to, in this lesson for today, we're going to talk about group goals, so you know what they are when you achieve them, and you know where the group is going, and you're going to know what part you play in that. So there is some PDF form that's easy. You can download that I have it there, but let's just see. We're going to do some readings, and everyone's going to take part. So number 1, person number 1. Who is going to read number 1?
That's me.
Okay, so go ahead.
Lisa.
Go ahead, Lisa.
Okay. In the majority of alcohol and drug treatment settings, group counseling is seen as one of the most effective means of promoting change and personal growth. The reasons for this are numerous, but the central factor involved, which makes group counseling powerful, is the aspect of denial. For the chemically dependent individual, whose defense system is often very strong, the peer support and peer pressure that occurs in a group can be quite effective in breaking through the denial.
Okay, so one of the goals that you want to achieve in group is personal change. Okay, and personal growth. So personal change and personal growth relate directly to the definition of recovery of what we talked about in the beginning. Recovery is a process of change, which is blah, 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 blah. So group promotes growth and change, promotes personal growth and change. Now that's the personal people here. So when you're sitting in a group with them, each one of them is personally has an opportunity to change and grow as a group, but as an individual as well. And you are going to encourage that. Okay? Thank you, Lisa. And to read number 2.
That's me.
Go ahead.
As in any group counseling situation, there are a number of factors that allow the group setting to instill change. See outline for your own curative factors.
Okay.
The one therapeutic factor that seems to have the most profound effect on the chemically dependent individual is that of universality. The first step, one, takes in eliminating denial is to recognize that he or she is not alone. This recognition, known as universality, helps eliminate the isolation and perhaps demoralization that the individual is feeling.
Okay, so you've heard me use this word in this trainings, okay? Universality, and I want you to know what this concept is, because we're going to exploit that, okay? So with universality, what that is here's our boy Gary. Gary is saying something, and these people are relating to what Gary says. And Gary is relating to what's going on with this one. So it's like this. But actually, it goes like this. Okay? They are relating to each other as individuals, and everything that's going on with every other one in the group. This is universality. Okay? So what are you doing here? You are promoting universality. You're really not part of it, okay? And I've said this in the part one of this, that if you're doing most of the talking in the group, you're not doing your job, okay? If you are the one who's pontificating and explaining to the clients what they need to do to recover, because because you're, the counselor, or you're the social worker, or you're the expert, you never want to take an attitude of being the expert with addicts, okay? They're resistant, and they'll clam up about that, okay? So, but you can promote universality and promote change and personal growth. So universality, when that is going on, you'll know when that exists. It's like a magic moment almost. You'll see it, you'll witness it take place in front of you. And you're going to use that and say, promote that. Don't tell me, tell them. Tell them. Tell Joe's there. Joe's got 16 days free. He feels good about that. How do you feel? Don't tell me, tell Joe. And they'll say, hey, Joe, I'm really proud. You're going to promote that. And like I say, if there's a new person there, they'll move along with it. They'll get swept up with that. So universality is a very important concept to be aware of, and you want to use that to your advantage to help them progress towards or achieve their treatment plan objectives and goals. Okay? Okay, good. Okay, so number 3.
That's me.
Go ahead.
Through peer support and peer pressure, the individual can begin to identify with others and admit his or her problem. This admission can come about through the power that universality gives to combat cultural forces that lead to denial. Through confrontation, the group can assist in altering the substance abuser's defensive style and help eliminate his or her distortions that lead to denial.
Okay, so peer support. It's obvious, right? It's self-explanatory. I don't have to explain what that means, but I'm going to explain it anyway, because it exists in this situation. Okay, so with peer support and universality, individuals, yes, as part of the group, can shift their perception of reality, or hey, that can work for me. Now, I'm thinking of the person who's in group for the first time, and these are real life scenarios that I say. I get a little emotional when I think about this. I mean, I've run tens of thousands of groups, but it was a 19-year-old kid or 21-year-old young person, young man, He'd never been in treatment before. He didn't know anything about recovery or treatment or something. And now he's in group. And I went back to him because I'm saying, I'm observing with him, his eyes, he was like a deer in headlights. His eyes were like popping out of his head, you know. And I asked him to, you know, hey, you know, Joe, I noticed that you're kind of, you know, like, you know, I can see that, you know, you're a little, you know, excited about what's going on. Why don't you just tell us about that a little bit more? And he said, I thought I was alone with what I'm feeling. I've been sitting up in my room for the last 3 weeks in my parents' house thinking how alone I was and that nobody understands me and nobody can relate to my pain and misery about my drug addiction, okay? And I just thought I was alone. And now that I'm here and hearing everybody else through, I realize that I'm not alone. Everyone else, and everyone in the group go, no. I can relate to what everybody's feeling and talking about, and everybody else in the group is going, yeah, And I'm not. I see that everybody else has felt the same way, and they're all in the group going, yeah, we feel the same way. You're not alone. Yeah, those feelings, I felt those. And I said, well, don't tell me, tell Joe, he's there. Well, how does it feel, you know? How does it feel hearing this? I said, this feels, you know, and I promoted universality to help this one guy go through his own personal change, his own personal growth, because I was aware, you're aware of that, and you see that, and you observe that, and you use this process to help, you use this to help the one person go through personal change and personal growth. But you're using the group to do that. And you can't do that in an individual counseling session. You can't do that. You can't do that as a parent, as a best friend, as a boyfriend. You can't do that. You need to get, you know, you can't tell somebody what they need to do to change. But this is a tremendous asset to us as counselors, as clinicians, as therapists. I'm just going to point out here where it says about help eliminate his or her distortions that lead to denial. What they're talking about there is cognitive distortions, okay? So as we go through this course, I'm going to have another lesson that's going to explain what cognitive distortions is from a psychological perspective. I mean, I was a psych major before I was a professor in the CASAC, but cognitive distortions are something that exists, like with cognitive behavioral therapy. You have to be aware of it as, I mean, I was aware of it as a counselor because our patients will use their cognitive distortions to be in denial. And the reason they do that is because it's worked for them. It works for them with their parents, with their family, with their best friends, with their boyfriends. When we get into cognitive distortions or black and white thinking, all of this or all of that, I'm going to give you a little more explanation about how we can help break through an individual's cognitive distortions or cognitive denial that they've been doing for years because it's worked for them with their family and friends and everything like that. We can help them, not through confrontation, but through this process, we can help them eliminate that and see, wow, that's not going to work for you. Because the reason it's not going to work for this one is because these people are going to tell them that's not going to work for you. Okay? All right, so thank you, Gina. And number 4.
Number 4.
Yes.
Another important therapeutic factor that occurs in groups with a chemically dependent person involves interpersonal learning. Alcoholics and drug-dependent individuals commonly share difficulties in interpersonal relationships. The group setting provides a safe environment to learn new ways of communicating needs and feelings. Members tend to be accepting of one's expressions of feelings in the group, and they are free to give feedback to each other.
Okay, so the next part of the group goals that we're going to encourage, I don't like to use exploit, but we're going to use encourage, exploit to our advantage to help the patients address their cognitive distortions and to address their denial, whatever it is. It's going to help them achieve their treatment plan goals and objectives. It's going to help us be counselors, facilitators of the group. Interpersonal learning. Interpersonal learning. What did it say about the feelings there? Help them communicating their needs and feelings. So help them communicate their needs and feelings. So when it comes to communicating their feelings, and remember, we're looking to identify feelings. We're helping them to identify their feelings and their unresolved feelings of the records that they've caused from their past, records to themselves, to their family, to everybody around them, because they lied, robbed, steal, cheat people who love them the most. Through interpersonal learning, we're going to help them better communicate their feelings, identify and communicate their feelings through universality. And our patients are not good at communicating their feelings. They're not good at talking about their feelings. They're not good at feeling feelings. They're not good about feeling honesty, hope, faith, courage. Hey, this thing can work for me. We talked about integrity. That can work for me. These things exist. They have not allowed themselves to feel those. I need to be honest with my feelings today. Listen, if you're coming from the addicts or the drug-using subculture of our society, they're not talking about their feelings out there. They're not talking about feelings with their people they're using with. As a matter of fact, to be vulnerable, they would be vulnerable if they thought, I'm really going through some feelings today, and I need to get honest about that I'm not happy with the way I'm living my life. They can't talk like that with their friends, their using buddies, and shooting galleries, or abandoned buildings, or in a bar and drinking with their and getting high and stuff like that. Especially in they would be taken advantage of. They'd be right. You can't be honest with your feelings out in inner city shooting gallery or drug infested where they're getting high. There's no honor there. There's no friends there. There's no allies there. You're on your own out there. They're robbing and lying and stealing and cheating each other, even their buddies, their friends. They're robbing their friends, and they're helping them. But this is a joke. The difference between an addict and an alcoholic. An alcoholic will steal your wallet, but an addict, will steal your wallet, steal your money, and help you look for it. They're looking around. What, you drop it under there? Is it did you check your pocket? Is it over there? Is that it there? Like that. And they've got it. And they rob each other of each other's drugs. So there's no real honor among that population or getting honest with their feelings or being true. But so when you put them in this situation in group therapy, we want to encourage that. We want to take advantage of that because they don't know how to do it. So through seeing other people doing it and having it be okay is how they learn. That's called interpersonal learning. So they're learning from each other. They're not doing that out there. They're learning how to get over and rob and lie and steal and cheat and kind of rip off and stuff. And they always got a hustle going on. But through interpersonal learning, they'll learn about how to change and grow and be supportive of each other in their recovery through interpersonal learning. And we want to know that exists. You're going to witness it, you're going to see it, and you're going to use that to help you, to help them. Okay? Number 5.
That's me.
Okay. Well,
Where am I?
all right there, Norma.
Okay. Although the feedback may be confrontational at times, a trusting relationship among group members will foster the acceptance of the feedback and allow the individual to gain self-understanding and psychological growth. Hence, the group can be seen as a microcosm of society and provide a safe arena for each member to try out new behavior. These changes are crucial for the chemically dependent person as he or she adjusts to a new life without alcohol or drugs.
Thank you, Norma. Very, very good. Okay, so let's look at that. So that is a trusting relationships. They build trusting relationships. And we were just talking about how our clients, drug addicts, don't know how to do that. They don't know what that is. And as a matter of fact, trust is one of the topics that we're going to look for them to identify when we're doing the feelings check, or it can be a topic. I'm going to give it we're going to do more specific stuff about topics, because we do kind of, not that we pick topics, but how to identify a topic when it comes out in the feelings check. But trust or lack of trust or untrustworthiness or trustworthiness, or how can you I can't even trust myself, they'll say. Someone will say, I want to learn how to trust myself, trust my decision-making process. Our patients do not trust themselves. They do not trust their decision-making processes, and they don't even know it. So when trust comes up as one of the spiritual principles, or honesty, hope, faith, trust. So trusting relationships and developing trusting relationships, they're going to learn that through interpersonal learning through here in the group. Okay, so when it comes to topics, trusting relationships, if I said, let's pick a topic, I'm going to give you another lesson about topics and how to pick topics and how to do stuff with topics. If we let the patients, pick a topic, 90% of the time, they're going to pick communication with their family. It's going to be something family relationships, trusting relationships, family relationships. And a lot of it has to do with they can't trust themselves. They can't be part of a honest, open, trusting relationship because they're not honest, open, and trusting of themselves. And they can't do that with somebody else or be in a relationship like that if they can't do it with themselves. So they're going to learn that. They're going to learn trusting relationships through here, because Billy is not going to tell Johnny or Gary, and Gary is not going to tell John and Billy anything that's going to be bad for them. And you're going to be here facilitating. You're going to know. They're not going to tell them, yeah, it's okay to use. Just use Coke once in a while. You'll be okay. Just use it on a weekend. Nobody's going to tell anybody that. And if anybody tells anybody like that, that's when you're going to intervene. Like when we get into the TAP 21, you're going to know when to intervene, when it's going off topic. And one thing, you're never going to let them have glorification of drugs, that it was great. When I was, we're never going to let them do that, We're going to, steer away from that. There's no glorification, self-aggrandizing in group that, nobody was going to, I knew how to really know how to get high better than anybody else knew how to get high. We're not going to do that. We're going to be talking about, the topic is always recovery. And they're going to trust each other to get the information that they're getting back and forth and sharing with each other. They can believe that will help them. And we're going to use that. We're going to encourage them to do that, and we're going to let them do that, and we're going to sit back, and we're going to document it and write notes about it, and that's, and it's going to be magic. It really is amazing stuff. Okay, thank you, Norma. Okay, number 6. Who's going to read number 6? Okay.
A skilled group counselor will know what to look for as well as how to and when to intervene. He or she is given the opportunity to observe patterns of communications for each member, something not possible in an individual setting. By being directive in his or her interventions, a counselor will guide the group's interaction in order to promote trust and risk-taking. By closely observing each member, the group leader will be able to help appropriately integrate each individual into a group that, when skillfully molded, will be mutually effective for all participants.
Okay. Promote trust. Promote risk-taking. Okay? You're going to witness risk-taking with their feelings. Okay, so from a skills perspective, and that's what this is all about. This is from a skills perspective, a skilled group facilitator. This is something that as you implement what I'm teaching here, if you implement these skills, you'll get better and better at it. and there'll be a natural occurrence at it. You'll get better like any skill the more you do it. And that is definitely going to benefit the patients. So when it comes to these group goals that you're trying to, when you witness that, when you achieve that, and you're letting that, you're encouraging that and letting that happen, our patients are going to take risks with their behaviors and expressing their feelings about something that relates to what this person is telling this person. They're going to relate to it, and they're going to go out on a limb and take a risk with talking about their feelings that relates to what Sally was saying. Susan is going to relate to what Sally was saying, and she's going to be vulnerable and go out on a limb and talk about that and take a risk with that, with what she's saying, with her speech, with her content, with her process, and how her behaviors, and take a risk. And you are going to sit back here and be aware of that and document it in your session notes and encourage that. Encourage those people to do that. So you're not doing a lot of talking. You're not doing a lot of in charge. They call them group leaders sometimes, but you're facilitating this group process. Okay? So I'm just going to read this last note. Good group facilitation is much more than conducting therapy with a number of individuals in group. It requires an active counselor who is constantly observing all the nuances of the members' interaction. It requires a skill that can only be mastered through supervised group experience and in understanding the group process and group dynamics, okay? So, good facilitation requires, I say, you are constantly observing the group. You're actually mirroring the body language of the person who's speaking. You're constantly observing. When I'm in group, when this person is sharing something, which is probably pretty serious stuff too, and that's good, okay? But I'm looking at I'm looking at everyone. I'm constantly observing anybody's reaction to what Sally is sharing. I'm looking at Susan and Mary and Bob and to see if there's any reaction to them. And so there's a relationship there between their feeling something, they're reacting to something that someone is saying, and I'm constantly observing that, and I'm going to maybe go back to that. I noticed you were nodding your head in agreement with what Sally was saying. Were you in agreement with what Sally was saying? And oh, okay. Well, don't tell me. Tell Sally. She's right there. And then oh, good. Sally, how does it feel hearing it from Susan? Did she agree with what you were saying? Anybody in the group agrees with what Sally's saying? Raise your hand. I raise my hand too, and everybody raises their hand. Okay, so there's this universality, this trusting relationship, and that Sally took a risk by sharing with Susan that I related to what you were feeling because that happened, this and that, and that. So that this is great stuff, man. So that's what we do. It requires a skill. I'm teaching you these are counseling, group therapy counseling skills. Okay, so this is what the group goals are. Okay, so be aware of them as they're happening. Okay, promote change. Promote personal growth. Universality, very important in the group process, from a skill to even know that is happening, and to encourage it to happen and exploit it to help our individuals achieve their treatment plan goals and objectives. And you know what they are, okay? Peer support. They support each other. Interpersonal learning. They're going to learn from each other more than they're going to learn from you, okay? That's why you can't be telling them what they need to know. What you need, I'm role-playing now, what you need to do to recover is you need to get your shit together because you're acting like an asshole now. Not that we would ever say that, but they're not going to listen to us Don't be the expert that's going to tell them what they need to know, what they need to do to overcome this obstacle that they're being presented with. They're not. It's going to have much more of an impact when you do it like this through universality, peer support, and interpersonal learning. Going to have much more of an impact than us telling them what to do. Okay, so you're going to use that. And then trusting relationships, they're going to develop trusting relationships in group. And we're going to encourage risk-taking and being vulnerable and talking about their feelings and having it be okay. That they're going to do that and it's going to be okay. They're going to do that and it's going to be okay, and that is going to feel good, and that's going to reinforce them to repeat that behavior in group, and they're going to learn new behaviors, new getting in touch with themselves, and how that's going to help them, and that feels good. It's going to be reinforced through these group goals in the group therapy process, which you are going to facilitate. Okay? Any questions? Okay, go ahead. Ginger?
Hi, Professor.
Hi.
Can you just explain a little bit more about how we're encouraging risk-taking with feelings? Is that what you mean by being vulnerable?
Yes.
Just allowing them to be comfortable? Or
Yes.
are there other forms of risk-taking that we should be encouraging them to approach, in
Okay.
parts of their recovery?
Okay, so yes, to be vulnerable, yes, or the risk is for them to be vulnerable. So they're very defensive, very secretive, don't share a lot of stuff. They're living behind armor, really, because they can't be vulnerable out there in their world because they'll be taken advantage of. So we're going to encourage them to be vulnerable with their feelings, to be honest with their feelings, to risk their behaviors of what they're saying and the relationship they're building with another member or the group or with you as the counselor. So that behavior for them is a risk that they haven't done before, so you're going to encourage them to take that risk. Okay, so with the behaviors, it's really developing relationships within the group. So this is something you want to be aware of. Now, what I do is, especially with IOP, okay, we're going to take a break, 15 minutes, and everybody goes outside and they're hanging out. I would go to the window of the office and I would look through the window of the office. I would see who's hanging out with who's talking with who, and they're developing relationships. When we get into another lesson, I'm going to talk about with 12-step stuff. It's going to be, they could be going to 12-step meetings together. We're going to encourage that. That would be risk-taking with their actually observable behavior. 2 or 3 of them are going to a 12-step meeting together. So they're vulnerable. They're taking risks with their feelings and talking about their feelings, and they're being vulnerable with their behavior. That these trusting relationships, they're actually going to 12-step meetings together. They go out for coffee after group to the diner, and sit around talking about recovery. Nobody's getting high, and it's actually good. They feel good. That's the type of risk-taking that I'm talking about. So it's twofold, both with their feelings, being honest with their feelings, and their behaviors. Okay? Does that answer your question, Jean? Okay?
Yes.
All right,
Thank you.
good stuff. Good question. Any other questions there? Did I just wow you so much that there were no questions? Okay, so look, between what we did in the last lesson as far as the feelings check and picking the topics, and now we know what this is, I'm going to get into more stuff about how to work in this environment with the group from from a group therapy, the group therapy process, from the skills that you're going to learn how to use in group therapy. I'm going to get a couple more things on lessons on that that has to do with one about the cognitive distortions, and then actually picking a topic. You can pick some topics, but there's a way to do that. Yes, you let them pick the topic. It's their topic, but you kind of picked it. You let them pick it, but you're going to push forward that topic. And then we're going to do stuff about how to introduce 12-step concepts into this group setting through a process with 12-step facilitation therapy, it's called. 12-step facilitation therapy, how to introduce 12-step concepts and principles into this setting. There's a special way that I've developed over the years that I'm going to share with you guys, and this recording, it's going to be shared with you guys, okay? I mean, the information that I have, that I've developed over years, I'm free with. It's free for anybody, okay? All right? Just let me look at the time, because remember, I can look at the time without you guys seeing that I looked at it.